Hello, students. In this chapter, in the last chapter, or the last week of your course, Sci 1010, General Psychology, we want to talk about some treatments, approved science-based treatments for mental disorders. So we know that we started confronting with mental disorders, not as a phrase, so something like mental disorder. For example, they said that they are insane. They are have some out of body experience, not out of body experience that you have in your sleep. Out of body experience, some things, some people, some beings, they are not humanistic beings out of your body, and they come into your body and change some, for example, something like evil. And we have some magical treatments. Also, honestly, they are not called treatments. We had some magical interventions about 2000 years ago, from 2000 years ago, or a little more older than time, until the end of 19th century. At the end of 19th century, with the improvement in the basic sciences like biology or physics or chemistry, and also in applied sciences, especially in medicine, scientists in the field of medicine, so-called psychiatrists, found that we are encountering with people, we are encountering with a human being, and such a behavior with a human being, because of he or she has some problems in behavior or some problems in his or her mind, it is not humanistic. Also, it is not science-based. It is a very old-fashioned intervention, old-fashioned reaction and interaction with people with mental problems. So gradually, in the second part, in the second half of 19th century until now, we have improved our looking, our viewing to the mental disorders and people with mental disorders. This is called psychological treatments or psychiatric disorder treatments. There are different approaches here. In different approach, you can see the mental disorders and also the treatments. But five major parts, especially instead of, if you want to, let me share the PowerPoint with you. Five major approaches. We have five major approaches to encounter, to face with the mental disorders, to confront with the mental disorders, and to give them some types of treatment, which is called therapy and treatment. Treatment is specific for the part of physical base, and therapy. Here, therapy is for psychotherapy, especially for psychotherapy. At first, we consider that the origin of mental disorders is related to your early childhood experiences. And in your early childhood experiences, we have some types of forces shaping the forces that for the rest of your life, they will act as a dynamism, as a dynamic, as a force to create, to shape, to control, and to work with your mind, with your behavior, with your emotions, with your thinking and thoughts. It is called psychodynamic. So psychodynamic is an approach that we consider as the basic part of behaviors, basic part of treatments. We should before that, we should consider the definition for psychotherapy. Treatment in which a trained professional, a therapist, uses psychological techniques to help a person overcome psychological difficulties and disorders, resolve problems in living, or bring about personal growth. And biomedical therapy that relies on drugs and other medical procedures to improve psychological functioning. We have two major approaches to behavioral problems. One, It is about the emotions. It is about the thinking. It is about the attitudes. It is about the culture. It is not about the biological imbalance. It is not about the brain. It is not about the nervous system. It is not about the body. In this approach, we call it psychotherapy. Treatment for psychological problems through the psychological tools. For example, creating and modifying your cognition, your thinking, your emotion, how to handle your emotion, how to change your rational or irrational, for example, beliefs and other things. On the other hand, a biomedical approach to mental disorders, to behavioral problems, we consider that these mental disorder, that these behavioral problem is rooted in a very, very basic biological root, biological cause. For example, your hormones, your transmitters, your nervous system. It is related to your body and to your brain, especially to your brain. It is called biomedical approach. So biomedical therapy, as you said, and we can consider some uh, creating some changes in your biomedical balance. For example, using the medication, different drugs, different medication, different pills, different injection we have for uh, using in treatment of mental problems. It is called biological or biomedical approach and psychotherapeutic approach. What is psychodynamic? Seeks to bring unresolved past conflicts and unacceptable impulses from the unconscious into conscious, where patients may deal with the problem some more effectively. What are the key words in psychodynamic approach to psychotherapy or to mental disorders or to behavioral problems? One, past life or early childhood. Two, conflicts. Three, insight. It is about your history, create changes, and the therapy is based off insight, knowing about your unconscious. Freud divided your consciousness in three levels, your awareness in three levels. One, conscious. Two, subconscious. Three, unconscious. It's like an iceberg that the top of the peak of the iceberg is your conscious. A little down, a little lower part in the water is called subconscious, and the deepest part is called unconscious. So the process of psychotherapy is focused on changing in unconscious and giving up and pushing up the unconscious to come up and having a conscious about your unconscious. Freud says that unconscious shows itself in three areas. One, in jokes, in slips, speech slips. Sometimes it is called Freudian slips. When you don't want to say something and but you say it. It is about your unconscious. Secondly, in your dreams when you are asleep. And especially the dark side of unconscious. Remember that unconscious is shaped because of your suppressed or repressed or denial and other parts of your personality. You don't want to remember those. Because of that, we call it unconscious. You don't want to remember something that creates stress in you. So you will use some tools, some psychological tools to defend against the stressful and stressor memories. It is called defense mechanisms. You are using your defense mechanisms. Also, it is called depth psychology. I love it because it is very deep and change your total, not change, filter and defilter your personality. You will be the same one as you are. You will be friendly with your nature, and you are your nature. It's the natural limitation. Yes, it is the natural limitation. Why not? It's so good. So you should know that If you want to know about your unconscious, you should pay attention to your speech slips. You should pay attention to your uh, dreams. But if your unconscious cannot release itself through your jokes, through your speech slips, through your dreams, it will be and will show itself in psychological disorders or mental disorders. So, in psychoanalysis, Freudian psychotherapy, especially that part of psychodynamic, which is specifically from the therapeutic approach, therapeutic methods of Sigmund Freud, is called psychoanalysis. Psychoanalysis is only one part of psychodynamic. Freudian psychotherapy, in which the goal is to release hidden unconscious thought and feeling in order to reduce their power in controlling behavior. And we have here a technique so-called free association. Free association, a patient says aloud whatever comes to mind, whatever. Analyst connects this to the unconsciousness. What does it mean? It means that you will be on a couch and you are talking about yourself. Whatever is coming to your mind, whatever associated to your mind, with no judgment, with no interpretation, with no shame, nothing, with no guilt feeling. And what is the role of therapists here? Nothing. Therapists only connect. You're talking to your unconscious. Create meaning for your talking. Because of that, it is called curative talking or healing talking. The next one is dream interpretation. I think it is 1905 or 1904 that the first book, the first major book of Freud was published. In psychopathology and psychotherapy, we said that it is the origin of methodological approach to mind. So it is because of deep approach to life, deep approach to past life. It is especially for the people who wants to know about the very deep causes of their behavior, very deep causes of their mind, of their emotions, of their feelings. So the book is called Interpretation of Dreams by Sigmund Freud. It's fantastic, very, very fantastic. Based on this book, and before this book and after this book also, Freud created a very, very powerful technique, so-called dream interpretation. Let me check there. Perfect. Freud created a very, very deep approach to mental disorders and also to your mentality, your mindset, to your feelings, so-called dream interpretation based on that book. And transference. What is transference? During the psychoanalytical session, based on the Freud's methodology for treatment, during these sessions, the patient is talking. Everything comes to his or her mind, everything. And I, as a psychotherapist, am there only for one reason. I am a symbol of your hidden parents, of your suppressed emotion. You should experience your suppressed emotions with me. It is called transference. Transfer of feeling to a psychoanalyst of love or anger that had been originally directed to patient's parents or other authority figures. It is a therapeutic process, yes. It is a healing process, yes. But on the other hand, we can consider it as the Countertransference. What is countertransference? The only approach in psychotherapy that it is needed for psychotherapists to be healed, to be cured, before entering the psychotherapy session as a psychologist, as a psychotherapist, it is psychoanalysis. In psychoanalysis approach, if you go to every school of psychoanalysis in California, in America, and other parts of the world, they said to you at first for 6 years, sometimes between 3 years or 6 years, you should be under the treatment. You should be treated. You should receive psychoanalytical treatments. And after that, yet you will be a good person. You will be a healthy person. You can again start to do psychoanalysis for other people. Because of that, countertransference is a transfer of psychoanalyst feelings to patients. Sometimes psychoanalyst sees that he or she has a lot of anger, has a lot of things to do with or against the clients, the patient. It is countertransference. Psychodynamic therapy can be time consuming, between 2 to 5 years, expensive, sometimes between 1 or 2 sessions per week for 2 to 5 years. And it may be difficult to determine effectiveness, but it also may provide solutions to difficult issues, insights, and treatment for psychological disturbance for some people. For example, in personality disorder, in rape, in a person with a bad history of childhood. In contrast of psychoanalysis as a long-term, deep approach to mental disorders. At the beginning, at the first decades of the 20th century, with the improvement, with the advances in basic hard sciences, for example, physics and chemistry, especially physics and chemistry, which was based on the observation and measurement. It is the classical definition of science. Science is a method for gathering, analyzing, and resulting from information based on the observation and measurement. It is the major difference between the science, philosophy, and mysticism. Philosophy is gathering information based on your rationality, no need to observe, no need to measure. And mysticism in gathering information only based on your intuition, no rationality, no observation, no measure. Also, it is about gathering information, data collection, and sometimes it will end to data analysis and result, and can have discussion on your result, for example, in mysticism. But basically, the method for gathering information in mysticism is about intuition. And in philosophy, you will gather information based on your rationality, your logic, your reasoning. And in science, we will have observable and measurable data. Based on this approach to science, also to human being, between 1920 and 1930, J.B. Watson, the founder of behaviorism, says that only that part of human being that can be observed and can be measured is a matter of science. Other parts, there are other parts, but they are not the matter of scientific approach, scientific investigation. Also, J.B. Watson says that there's no other parts. But after J.B. Watson, other behaviors say, for example, yes, we have something like perception. We have something like feeling. We have something like love. We have something like hate. But we cannot observe and measure your hate, your love, your feeling, your perception, your sensation, and other things. Consider that we are talking about the something that we have we are talking about the time that we considered science for every approach of life. Okay. Based on this approach to human being, they consider behaviors as the only measurable and observable components of human being. And at first it was called behaviorism, and after that it became behavior modification, and finally it became behavior therapy. Treatment approaches that build on the basic process of learning, conditional learning, apparent learning, classical conditional learning, apparent conditional learning, and social learning, observational learning, header learning. Based on the learning, they said that you shape your behavior intentionally or unintentionally, but your behaviors are shaped by your environment. Assume both normal and abnormal behavior are learned. So they help us to gather a huge amount of information about how our behavior is shaped by, especially by our environment. But it is not deep. Only what you measure and what you observe and what you measure. It was a revolution in the therapeutic approaches to human mind, to human behavior, to human being. Why? Before that, we consider everything is so deep. And also, you remember in Freudian approach, we said that we don't have we don't have enough evidence to say that yes, it is true or it is not true. Behaviorism is very, very observable. So in industrial psychology, in organizational psychology, in customer psychology, even especially in behavioral problems. For example, just now, at 2021, just now, the most applicable and approved procedure method for working with autistic people, autistic children, is ABA, Applied Behavioral Analysis. Applied Behavioral Analysis, ABA. It is very famous, very approved, based on the only observing, shaping new behavior, and measuring the range of shaping. So it has the specific status in psychotherapy, but very limited. For example, aversive conditioning or aversion therapy we use for alcohol. You think that when you use alcohol, when you drink alcohol, after that you have a good sense of euphoria. You will be a little high. Sometimes you will laugh. Sometimes you are happy. And we will give you some medication, some drugs that it has counterindication with alcohol. And after that, you use alcohol and you have something like hyper vomiting in pregnant people, pregnant ladies. You don't have any good feeling, then a good outcome. Just we're talking about the outcome, consequences of your action, outcome of your actions, outcome of your behaviors. After that, you don't have any good feeling about using alcohol. Yes, the same stimuli, but different consequences. They will change the relationship between stimuli and response. The same stimuli, they're aversive, not good results or consequences. It is called aversion therapy. We don't change your craving for using alcohol. I say, okay, every time you have a good craving, a high craving for using alcohol, use alcohol. But before that, please use this pill, use this tablet, and after, for example, 1 hour or 30 minutes, use alcohol. So something like this. Reduces the frequency of undesired behavior by pairing an aversive, unpleasant stimulus with that undesired behavior. Other techniques is here systematic desensitization, a behavioral therapy technique in which systematic, gradual exposure to an anxiety-producing stimulus is paired with a relaxation to extinguish the response of anxiety. You are experiencing gradually, little by little, the anxiety-producing stimulus. At the same time, you think that, I am pairing it to a stressor, to anxiety-producing stimulus with relaxation. The same stimulus, the different response. When you are relaxed, You cannot have the same overreactive response, over response to that, for example, a stimulus like something like anxiety producing a stimulus. Because of that, it is desensitization, systematic, gradually, step by step. And a hierarchy of fears, for example, at first you consider that what is the number of fear I'm experiencing in each situation. And from the lowest grade, very, very little fear, to exposure to little fear with relaxation, don't have the same. And after that, the exposure to next one, to next one, to next one. After sometimes you see that, uh-oh, my responses are different. Yes, we have also the same anxiety producing stimulus, but I don't have the same response as a very overreactive response to that stimulus. This is called systematic desensitization or hierarchy of fear that we should, and also exposure treatment for anxiety in which people are confronted either suddenly or gradually with the stimulus that they fear. But relaxation training is omitted, and also flooding, for example, for obsession, watching obsession, we use flooding, confronting suddenly with the highest stress or anxiety producing stimulus. And after that, you see that, uh-oh, I can overcome my anxiety for the same, it is flooding. Also, it is sometimes a little dangerous. You should check the physical status of your client, for example, about their heart, about the blood pressure, about the um, some parts of your brain. But it's flooding. It's shocking. But if you can do flooding for your clients, also if you are a trained psychotherapist, it is perfect. And also, you can see here the keywords of conditioning, treatment based on reward and punishment. All the treatment based on reward and punishment are called conditioning approaches. For example, token economy or token system, especially for schizophrenia and autistic people with addiction. Contingency contract to work on the outcome. It's not about the classical conditioning, it's about the apparent conditioning. And behavioral observational learning or social learning or modeling or imitation found by Bandura, Albert Bandura. And you know that many behaviors you are showing to or you're exposing, you are pretending sometimes for other people is based on your observational learning. You are observing other people. And behavioral approaches to therapy works well for anxiety disorders, phobias, compulsions, impulse control, and learning complex social skills to replace maladaptive behavior. However, people do not necessarily gain insight about their maladaptive behavior. It is not about changing your attitude. It is not about changing your insight. It is not about changing your cognition, your thought, your belief system. It is only about changing your response to the stimulus or changing your expectation from your behavior. We have two types of conditioning. Your response um, to the stimulus, and or no, you are pretending or showing or doing some act or behaviors based on the future expectation, expected outcomes, which is called apparent conditioning. When we sit out in behavioral therapy, that we are not mouse, we are not rabbits, we are not bears, we are animal, we are not animal, we are human being with a very, very interventional, very, very interfered component, so-called cognition. So behavioral therapy for the beginning of therapy is very good. But after, sometimes you see that different people for the same training shows different results. Why? Because they think about their behaviors. This thinking part, this belief system part, this cognitive part, I think it is, yeah, 1970s and 1980s, entered to their formal approaches to psychotherapy, especially to behavior therapy. After that, it is called cognitive behavioral approach or cognitive behavioral therapy. Teach people to think in more adaptive ways by changing their dysfunctional cognitions about the world and themselves. A cognitive behavioral approach incorporates basic principles, learning to change the way people think. It is the most famous, efficient model for working with people, CBT. And Albert Ellis, Albert Ellis entered the uh, components of emotion in this uh, approach to human being or to mental disorders, so to change the behaviors and change the mind and change the feeling. You have three components. As a psychological being, you have three components: your thoughts, your feelings, and your actions, your cognition, your emotion, and your behaviors. So if you only work on your behavior, nothing has been changed in your feelings and emotion. You can deny them, but they are. It's not related that you deny themselves or not. They are. You have some different emotions, only in one single man or woman. You have different cognitions. So Albert Ellis entered the new component to approaches for therapeutic approaches to human problems, mental human problems, so-called emotion. At first, it was rational therapy, RT, and after that, he entered behavioral component and said it is RBT, rational behavior therapy, and finally it says it is REBT, rational emotive behavior therapy. Attempts to restructure a person's belief system into a more realistic, rational, and logical set of views by challenging dysfunctional beliefs that maintain a rational behavior. And the main core of the story is about cognitive therapy, coined by um, Aaron Beck, Aaron T. Beck. He's not American, he's British. The main core is about cognitive therapy, not looking at the behaviors, not looking at the emotions. When you consider only behaviors, it is behavior therapy. When you consider only cognition, it is cognition therapy or CT. When you combine behavior and cognition, it is very, very popular, very, very frequent between the different approaches of psychotherapy. It is called CBT, cognitive behavioral therapy. And when you consider the emotion, I didn't have any type of therapy, only based on the emotions. Also, we have something like emotion focus therapy, EFT, and emotional freedom technique, also again EFT. And we have affective science in Stanford University. But yes, when you consider only emotion, it is called emotion focused therapy. Emotion focused therapy is not based on the emotions only. It is the focal point. The focus is based on emotions, and they consider your behavior, they consider their cognitions and all the things. But your focal point is based on the emotions. And the combination of all of them is rational emotive behavior therapy, coined by Albert Ellis, rest in peace. And also aims to change people's illogical thoughts about themselves and their work. But it is less confrontational than REBT and coined by Aaron T. Beck. A major components, a major differentiative component, differentiative elements between the REBT and CBT and CT, cognitive therapy, is based on the confrontation. Whenever you are working with people's emotions, wherever you are working on people's emotion, where you are using emotional components of people to create change, also even in mood disorders, even in anxiety disorders, these are the problems of emotion. Also, we concentrate the emotional disorders, so-called, in the title of mood disorders, I know. But when you are talking about anxiety disorders, anxiety is a type of feeling. This is not a type of necessarily behaviors. Every feeling has some external behavior, yes, But what is the basic and main core of that problem? The basic and main core of the problem of anxiety is about your feeling. In all types of emotion-based problems, the major component, therapeutic component, is based on confrontation and looking face to face to reality. It reduces to fear, it reduces your anxiety, reduces your stress, everything. And in cognitive approaches to therapy, after these are until now we're talking about behavioral. In cognitive approaches, only talking about the uh, rationality about your belief system, successful for a wide range of disorders like anxiety, depression, substance abuse, and this eating disorder. However, being more responsible and rational may not always be helpful. We have some criticism about the cognitive approach to human being. Yes, after passing the cognitive approaches, cognitive therapies, you will be very, very responsible and very, very thankful about yourself and others. And sometimes it seems that you are so rigid, flexible, sometimes not always. Because you cannot consider your emotions. Sometimes you cannot consider the shaping process of your behaviors. You say only, yes, it is only because of my thoughts and belief system. But honestly, the most authoritative, science-based, research-based until now, so far, the most important things, the most approvable things is about cognitive therapy. Finally, we are talking about humanistic or interpersonal approaches to psychology, to psychotherapy. Begins with the 1916 decades in America with very, very popular figures, public figures like Carl Rogers, like Abraham Maslow. You have heard many times in your lessons about the management, the hierarchical needs of Abraham Maslow. It is about humanistic approach to human being, for genuinity, for authenticity, for responsibility, for freedom, for the meaning of life. Also, it does not begin and starts with Maslow or Carl Rogers. It starts, some people say it starts with Frankl, Viktor Frankl, the German psychiatrist who was in Auschwitz, one of the dying places by Nazis government to die Jewish people. And Viktor Frankl was a survivor. And after that, he created his fantastic approach to human being about the logotherapy. Logotherapy is meant therapy based on the meaning of life. And after that, we know that some uh, scientists, some psychologists, psychotherapists like Carl Rogers, counselors even, and Abraham Maslow created the humanistic approach to human being and psychology. What does it mean, humanistic psychology? Is there anything so-called animalistic psychology? Yes. We have a branch so-called animal psychology. Animal psychology is that branch of psychology who works on the shaping behavior without serious considering of your minds, of your feelings, of your emotions, of your cognition. Because consider that it is an animal, it's a sheep, it's a horse, it's a tiger, and we want to shape some behaviors in our animals. For example, for circus, you don't consider the mind of tigers, you don't consider the mind or thinking of lions. You only want to, based on the conditional learning, based on the learning principles, you want to shape some types of specific behaviors in your animal. It is called animal psychology or animalistic psychology. Also, it is the basis of human behavioral approach to human being. It is the basic of working with animals. But I am not only animal. I am an animal, but something more. I'm a specific type of animal, a specific species of animal. So love, poem, freedom, death. We are the only being on the world who experience death anxiety. None of other animals experience death anxiety. They don't think that yes, I will die someday. They don't go to in front of mirror and say, "Wow, how old I am now. I was so young." There's no conversation like this in animals. At least we don't know about it. It's just something like we are experiencing to going to mirror and say, "Oh," and use, for example, cosmetic surgery. None of the animals do something like cosmetic surgery. Going to mirror and say, "Yes, I'm young or I'm old." We are the only person. We are the only being on the earth that experience the hidden parts of ourselves. They experience the death anxiety, they experience the responsibility, they experience the freedom, desire to be free, not natural freedom. Natural freedom is natural. So in this part, we can consider that we cannot say that we don't have any specific dimension of humanity because of that very, very high level, very, very high graded approach to therapy is based on humanistic psychotherapy or humanistic therapy. Underlying the rationale is that people have control of their behavior, first control, and can make choices, choosing, and are essentially responsible. Control, freedom, responsible. For example, emphasize self-responsibility and self-actualization and self-fulfillment. These are the major concepts of humanistic psychology, person-centered therapy, so-called sometimes client-centered therapy. Goal is to reach one's potential for self-actualization. It is done by Carl Rogers. There is a very, very good book from Carl Rogers. Its title is, I think it's titled From Being to Becoming. From Being to Becoming. Author Carl Rogers, one of the best brains in the history, one of the best brains in the history of psychotherapy and psychology. For example, unconditional positive regard is the principle proposed by Carl Rogers in client-centered psychotherapy or personal or person-centered psychotherapy or therapy, expressing acceptance and understanding regardless of the feelings and attitudes the clients express. Everything is okay. Yes. It is about acceptance, not about approved. When you say, I approve something, you say that it is correct to continue. When you accept something, you say it is correct to be now. I accept that it is, but I can change it because I am responsible. Choice, freedom. You have the freedom to choose everything. And you should consider yourself as responsible for your choice. Does not mean therapist shows approval of everything that client says or does. Just the therapist is non-judgmental and empathetic, understanding of a client's emotional experiences. Only understanding, not approval. And the next part is interpersonal therapy, ITP, short-term therapy that focuses on the context of current social relationships, such as conflicts with others, social skills issues, role transition, or grief. And group therapy was created after World War II because of the army. At first, the psychotherapists want to have some therapy for many people, so-called groups between 8 to 10 people. And it was because of the cost and also because of the number of psychotherapists available to do work with the veterans after the World War II. But after sometimes they understand that we have some specific dynamics within the groups, between the group members, which is sometimes very useful to facilitate the normal and the formal therapies and sometimes create new tools for therapeutic approach. So it is called group therapy. Group therapy is something based on the supportive and directive approaches of to be a member of a group. It is called group dynamics. People meet with therapists to discuss problems with a group. For example, family therapy focuses on the family as a unit and its dynamic. And self-help therapy, people with similar problems get together to discuss, for example, Brave Men Support Group or Alcoholics Anonymous AA are the self-help groups. You are like me and you can understand me and you can have a good empathetic feeling about me because you have some experiences like me. It is supportive and sometimes directive groups. And evaluating psychotherapy, when you want to evaluate psychotherapy, you should consider some components. At first, it is remission. It is spontaneous remission, early remission, partial remission, and full remission or permanent remission. Spontaneous remission, recovery without treatment is fairly low. Sorry. For most people, psychotherapy is effective, but it doesn't work for everyone. It is an approach. It doesn't work for all people, but it works for many people. No single form of therapy works best for every problem, and certain specific type of treatments are better for a specific type of problem. Pay attention, note that we as a psychotherapists talk about the psychotherapeutic approach, not only because it is approved that this approach is the best approach for that or this mental disorder, because we know this approach better than other approaches. And also, based on the therapeutic research, we know we have some manual-based treatments, especially in cognitive therapy and CBT's, cognitive behavioral therapy. These are called manual-based therapies. Step 1, step 2, step 3, the last step, and the first step. So it is about the research on the effectiveness of many approaches of psychotherapy. But honestly, you cannot use always one single approach for all disorders or many approaches for one disorder. It is related to your personality, client's personality, and also sometimes the approach a psychotherapist uses is related to the psychotherapist character or psychotherapist personality. Thanks for watching this video. It was very short, and I tried to introduce you the major part of psychotherapy, and because you will hear about this, what is CBT, what is hypnosis, for example. Many people think that hypnosis is something like fun or fake. No, it is hypnotherapy. We can use hypnosis as a technique, not as a content, as a technique. Just like your spoon. It is not related what food you are eating. You can use your spoon for many types of food. Hypnosis, for example, is like a spoon. You can use it as a technique for doing many types of other approved psychotherapies. And thanks again. Bye.